Welcome to Studious. Today, we are exploring the anatomical blueprint. We will be mapping the borders, contents, and structural logic of the human body's cavities. But what exactly is a body cavity? Unlike a solid block of tissue, the human body is expertly compartmentalized into distinct biological spaces. Think of these as the body's internal rooms, specifically engineered to house and protect vital organs. From your brain to your bladder, every organ sits within a highly tailored environment that dictates its function. By the end of this video, you will understand gross anatomy on a deeply functional level. You'll start seeing the human body not just as a collection of random parts, but as a brilliant, interconnected architectural masterpiece.
If you were to remove the organs during an autopsy, you aren't left with a solid mass. Instead, you find complex, empty spaces. These cavities utilize three brilliant architectural strategies. First is structural armor, where solid bony walls encase the most delicate structures to prevent traumatic damage. Second is the hydrostatic cushion. Cavity fluids absorb kinetic shock and allow adjacent organs to slide frictionlessly against their walls. Third, these spaces act as quarantine zones. Physical barriers tightly compartmentalize the body to prevent internal tangling during gross movement and strictly limit the spread of local infections. Without these quarantine zones, a simple stomach infection could easily spread directly into the chest cavity.
At the highest level of organization, the body's rooms are divided into two main categories, the dorsal and ventral cavities. The dorsal cavity is known as the neural vault, and it houses the central nervous system. This is your body's ultimate safe, keeping the highly sensitive brain and spinal cord locked behind dense, thick bone. On the flip side, we have the ventral cavity, known as the visceral chamber. This massive, dynamic space houses the respiratory, cardiovascular, digestive, and reproductive systems. These two major domains reflect our evolutionary development, creating perfect environments for our tissues to thrive. In the subsequent slides, we will isolate these specific rooms using standardized specs to fully decode this blueprint.
Let's start at the very top with the cranial cavity, whose primary function is brain encapsulation. This vault's roof, known as the calvaria, is formed by the frontal bone anteriorly, the paired parietal bones superior-laterally, and the occipital bone posteriorly. The floor, or the base of the skull, is divided into the anterior, middle, and posterior cranial fossae. But this heavily armored vault has a critical exit hatch called the foramen magnum. This large, circular opening serves as the structural gateway, where the medulla oblongata safely exits the skull to become the spinal cord.
The brain isn't just touching bare bone. It's protected by four distinct layers. Layer 1 is the bone itself, such as the parietal bone of the calvaria. Layer 2 is the dura mater, a strong, double-layered outer canvas adhered to the bone that houses the venous dural sinuses. Layer 3 is the arachnoid mater and subarachnoid space, a fluid-filled shock absorber that circulates cerebrospinal fluid through web-like trabeculae. Finally, layer 4 is the pia mater, a delicate shrink wrap utterly inseparable from the cerebrum surface. Together, these nested layers provide the ultimate shock-absorbing protection for the brain.
Descending from the skull, we enter the vertebral canal, located squarely in the posterior midline. The anterior wall of this bony canal consists of the massive vertebral body and intervertebral discs, backed by the posterior longitudinal ligament. The lateral walls are formed by the pedicles, which are structurally incomplete to allow spinal nerves to exit sideways into the body. The posterior wall consists of the lamina, culminating in the spinous process, which are the hard bumps you can feel on your back. The structural logic here is brilliant. Stacking these vertebral foramina creates a continuous, flexible protective tunnel from the cranium to the sacrum.
Inside the vertebral canal, you'll find the spinal cord, meninges, and spinal roots. It features an outer buffer called the epidural space, packed with extradural fat, sitting just outside the dura mater to cushion against extreme spinal flexion. Interestingly, the solid spinal cord doesn't go all the way down. It terminates in the upper lumbar region. Here, it transforms into the cauda equina, which translates to horse's tail, a bundle of exiting spinal nerves. To keep everything anchored, the microscopically thin pia mater continues downward alone as the filum terminale. This physical tie secures the entire neural structure tightly to the coccyx.
Moving ventrally, we enter the thoracic cavity. Its core function is providing dynamic protection for cardiopulmonary organs. Its roof, called the superior aperture, is defined by the T1 vertebra, the first ribs, and the manubrium of the sternum, opening upward to the neck. The floor is completely sealed by the diaphragm divider, a massive muscular dome separating the thorax from the abdominal cavity below. The walls are a dynamic cage made of 12 paired ribs, costal cartilages, sternum, and intercostal muscles, perfectly balancing solid bone for armor and flexible cartilage for respiratory expansion.
Deep within the central thorax, sitting just above the heart, lies the superior mediastinum. This tightly packed space serves as a critical infrastructure corridor. It houses the airway via the descending trachea. The digestive tract safely passes through here via the posteriorly positioned esophagus. It also contains massive vascular highways, including the arch of the aorta and its 3 branches, the superior vena cava, and brachiocephalic veins. Finally, neural infrastructure runs through this corridor, specifically the vagus and phrenic nerves traversing the space. Any trauma to this dense real estate is immediately life-threatening.
Within the thorax, we also have what anatomists call potential spaces, the pleural and pericardial cavities. Imagine aggressively pushing your fist into a balloon. The balloon doesn't actually contain your fist. Your fist simply pushes into the wall. The layer physically touching the organ is the visceral layer, while the outer layer is the parietal layer. The pleural cavity surrounds the lungs with pleura and pleural fluid. The pericardial cavity, located in the inferior mediastinum, surrounds the heart with serous pericardium and pericardial fluid. Fluid trapped between these layers allows frictionless sliding for ventilation and heartbeat.
Let's dive deeper into the physics of the pleural cavity. The fluid in this space isn't just about lubrication. There is a dramatically lower pressure inside the intrapleural cavity compared to the intrapulmonary pressure inside the lungs. This difference creates a permanent, powerful vacuum seal. This vacuum is the invisible force that keeps the lungs constantly pulled outward against the chest wall. Without this negative pressure, the lungs would instantly collapse against their own elastic recoil. It is a stunning example of anatomical physics that allows your lungs to effortlessly follow the expansion of your ribcage.
What happens when these potential spaces fail? Consider the pathology of pericarditis and cardiac tamponade. First, a pathogen attacks the pericardium, sparking an infection. Second, inflammation causes the serous layers to swell, and normal smooth gliding is completely lost. Third, a friction rub occurs. The swollen visceral and parietal layers grind together, generating a distinct scraping sound and severe chest pain. Fourth, excess fluid bleeds into the sealed potential space. Finally, cardiac tamponade happens. Because the tough outer fibrous pericardium cannot stretch, the fluid pressure crushes the heart inward, preventing the chambers from filling with blood.
Directly below the diaphragm lies the abdominal cavity, designed specifically for digestion and filtration. Anteriorly, in the intraperitoneal space, we find the liver, stomach, spleen, and intestines, which are safely tucked under the fatty greater omentum. Posteriorly, In the retroperitoneal space, the kidneys and adrenal glands are securely packed against the posterior muscular wall and vertebral bodies. Interestingly, there is a false pelvis concept. Organs that sit above the bony pelvic inlet brim technically remain in the abdominal cavity rather than the true pelvis.
Finally, we reach the pelvic cavity. Its borders stretch from the pelvic inlet superiorly all the way down to the pelvic floor, or levator ani muscle, inferiorly. There are key differences in architecture here based on biological sex. The female pelvis focuses on a spatially distributed reproductive layout, containing the vagina, uterus, fallopian tubes, ovaries, and broad ligaments. The male pelvis focuses on compact posterior or inferior reproductive structures, like the prostate and seminal vesicles. However, both anatomies share the distal sigmoid colon, rectum, and urinary bladder.
Let's synthesize the master blueprint. The dorsal axis provides heavy bone encasement armor via the cranial and vertebral cavities, locking away the brain and spinal cord. Conversely, the ventral axis relies on a dynamic cage, muscular walls, and a bony basin across the thoracic, abdominal, and pelvic cavities. These house our cardiopulmonary, GI, and reproductive systems. From the rigid armor of the neurocranium to the dynamic vacuum of the pleura, the body's cavities are definitely not empty spaces. They are highly engineered biological habitats, vital for human survival. Thank you for watching Studious. Like, subscribe, and stay curious about the marvels of human anatomy.